Yes.
Hello, good afternoon, everybody. I am Dr. Feroz Ahmed Mir, consultant neurologist in the Department of Neuromedicine at Bengal Faith Hospital, Burdhaman, West Bengal. Today, we are coming live on Facebook to discuss and tell you some important things regarding stroke. What actually is stroke? Stroke, in medical language, we define it as any neurodeficit which is sudden and happens because of a vascular cause. What is that vascular cause? Means that the problem is with the blood vessels or with the blood circulation. So, how can a common person know that patient has developed a stroke? So there are some symptoms which when happen to a patient, that time the attendant has to be aware of those symptoms that this can be a stroke. Say first of them is if patient suddenly develops a weakness of any side of body. Say for example, patient develops weakness of left side or a right side of body. This can be a stroke if it happens suddenly. Second, a patient develops a problem with speech, like patient develops a slurring of speech, or a patient develops a volume of speech which is not understandable to the attendants. So that time patient can have developed a stroke. Third, a patient develops sudden dysphagia, like patient is not able to drink, he is not able to swallow food suddenly, or patient develops a problem with vision. If patient suddenly develops a diminution of vision, at that time patient can we can say that this patient has possibly suffered a stroke. Then when these symptoms happen to a patient, the attendant has to recognize them and he has to be active in taking the patient to the nearby hospital for appropriate management of this patient. So, what are the types of stroke? There are mainly two types of stroke. One we call it ischemic stroke, where there is problem that blood vessel, which is supplying blood to the brain, is blocked. And second is a hemorrhagic stroke, where there is a small blood vessel has ruptured and there is hemorrhage blood in the brain. So third entity we call is transient ischemic attack. Transient ischemic attack means patient has developed symptoms like stroke, but those symptoms have improved completely within 24 hours. And on imaging like CT or brain, there are no findings suggest of strokes. And these patients we call as these patients have transient ischemic attack. They are an emergency where these patients, the TIAs, have highest risk of developing stroke within first week, so they need to be taken to the hospital and managed appropriately. So first we will discuss ischemic stroke. There are risk factors risk factors for developing a stroke in every patient. Those risk factors, if treated before developing a stroke, can decrease the risk to have a stroke. The most common risk factor for a patient to develop stroke is hypertension. So everybody more than 30 or 40 years of age should have his blood pressure checked once or twice in every 6. Some medical advice which that patient needs to follow to control his blood pressure. When we call patient is having hypertension, when our blood pressure is more than 140 by 90, we call this patient is having hypertension. So there are different grades of hypertension and different modalities of treating hypertension that will be determined by the treating physician. These medications for hypertension on occasional basis. Say, for example, sometimes patient develops headache, he thinks I have developed hypertension, at that time he only takes medication, which is completely wrong. Patient once did diagnose hypertension needs to take medication continuously to decrease the risk for having stroke. And this hypertension not is not the risk factor for only stroke; it is a risk factor for having acute MIs like heart attacks and kidney disease and other things. For those things also treating hypertension is important. Then second risk factor, which is common in our general population, is diabetes mellitus. These diabetes mellitus, we once patient is diagnosed with diabetes mellitus having a fasting blood sugar of more than 126 or HbA1c of more than 6.4. That time, this patient needs to go to to a physician or an endocrinologist for proper management of this diabetes mellitus. And this diabetes mellitus is again risk factor for many other diseases, including in addition to stroke. So, treating hypertension plus diabetes is important for preventing the risk of having stroke. Third, which is most other common problem with the general population, is this obesity, where body mass index is more than 25. So the obesity is a risk factor not only for stroke, it is a risk factor for having hypertension, it is a risk factor for having diabetes, and it is a risk factor for having dyslipidemia, which in turn are other risk factors for having stroke. So once a patient is obese, he needs to have proper this lifestyle measures and has to go to an endocrinologist for proper management of this obesity. And other risk factor which is there for stroke is dyslipidemia, when abnormal lipids, yeah, a high cholesterol level in blood. There, those patients also need to go to physician for proper management of these lipids so that the risk of stroke can be decreased. There are many other risk factors like if patient is still it's not a hypertensive, he's not a diabetic, he has no obesity or this hyperlipidemia. There can be problems with the heart, like patient is having coronary artery disease, patient is having this arrhythmias or valvular heart disease. There is problem with the valves of the heart. Those patients are also at the increased risk of developing stroke. We call these patients, if they develop a stroke because of cardiac problem, we call these patients as having cardioembolic stroke. So there is one more entity known as atrial fibrillation, which non-valvular atrial fibrillation, which is common in elderly people more than 60 years of age, and especially more common in patients who are also hypertensive. So these patients have a risk of developing stroke. 5% patients AF develop stroke each year. So this risk factor is a highly modifiable risk factor for preventing stroke. So once a patient feels that he is having palpitations, he is having any problems with heart, he needs to go to a cardiologist. We will advise him some medications, ECGs, Holters, and these things will confirm his diagnosis, and he will be taken given medication so that he doesn't develop stroke and other embolic events. There are some risk factors which cannot be modified, which cannot be treated, like older age cannot be treated. So this is a risk factor of stroke, so it cannot be modified. There are some other risk factors, like if patient is having family history of strokes, his family members have had stroke, he is at an increased risk of developing stroke. And if patient has had a past history of stroke, he has suffered one stroke, so this is a risk factor having recurrent stroke. Then there is other entity known as hemorrhagic stroke. What are risk factors for developing hemorrhagic stroke? Again, risk factors for developing hemorrhagic stroke are the same, like hypertension. Again, risk factor for the uncontrolled hypertension is the risk factor for developing hemorrhagic stroke. This drugs, some drugs which are commonly used, like anti-analgesics and these antiplatelets, anticoagulants, they are risk factor for developing hemorrhagic stroke. This if patient is having some problem with liver or a hematological issue or a bleeding diathesis, they are the risk factors for developing a stroke, hemorrhagic stroke. Or if patient is having some cancer patients, they are at increased risk of developing stroke. So these patients, hemorrhagic stroke, these patients need to be take care of these diseases and these risk factors. So then the other issue, which is what is the treatment for stroke? Again, for treatment, we divide patients. Ischemic strokes have very advanced treatment nowadays. In past, we were saying that there is no treatment except for giving this aspirin and the clopidogrel and this anti-lipids. But now the treatment has advanced. In ischemic stroke, whenever a patient develops stroke, he should reach to the hospital at within 3 hours, 4.5 hours, because treatment in ischemic stroke depends on time. In neurology, we say time means brain. Once you lose time, you lose brain. That's true for ischemic stroke. So whenever a patient or a person feels that he has developed any neurological deficit, that he should reach the hospital immediately. He should not waste time at his home or in his office, just waiting. And once he reaches the hospital, there are available treatments which can reduce his morbidity and reduce his. He can go to the work if he is received appropriate treatment. His disability can be less, and he can be back to work within no time. So once the patient suffers stroke, he has to reach the hospital immediately. There are two treatment methods available, which can be given immediately. One is IV thrombolysis, which can be given within 4.5 hours, and at second is this mechanical thrombectomy, which can be given within 6 hours. And if a hospital is this tertiary care hospital where there are imaging modalities available, and those hospitals can extend the time period of these treatments to up to 24 hours. So any patient who develops stroke has to reach to the hospital immediately. He doesn't have to waste time at home or in any office or at his place of work. So after that, once patient is thrombolized or his mechanical thrombectomy is done, then there are measures to prevent. We call them secondary prevention of stroke. We give them drugs. We evaluate the patient for the cause of the stroke. We once the cause of the stroke is known, we treat that cause so that patient doesn't have a repeat stroke. In hemorrhagic stroke, although there are no specific treatments, but hemorrhagic treatment conservatively they can be managed. They can, if patient develops complications, those complications can be treated, and patient can go home well. It's a misnomer. We have some myth that once a patient develops stroke, he cannot work, he cannot come back to his normal life. That's a misnomer. About 80 to 90% patients of stroke, once treated appropriately, can return to their normal work within 3 to 6 months. There are very less percentage of patients of this stroke which have remain with disability after stroke. So after this, now what are the this? How can we decrease the risk of stroke? How can we once a patient develops stroke? How can we move forward? That time, once we can decrease the risk of stroke. If once the patient is having the risk factors for stroke, as already this explained to them, hypertension, diabetes, and this dyslipidemia, these things. Those things are to be treated appropriately to decrease the risk of stroke. And once the patient has developed stroke, he has to come to the hospital and get appropriately treated. And once appropriately treated, he can save his life, and he can save his job, and he can get back to work within 3 to 6 months.
अच्छा, एक्चुअली सर 2-3 चीज हम क्वेश्चन करेंगे जो आप एक बार थोड़ा हिंदी में बोलिए, मतलब वो लैंग्वेज के लिए 2-1 लिखा है कि कैन यू ट्रांसलेट इट इन हिंदी, तो आप एक बार हिंदी में छोटा सा कुछ बोल दीजिए।
मैं अब हिंदी में 2-3 बातें बताना चाहता हूँ। जो हमारे ये ऑनलाइन लिसनर्स हैं जो इंग्लिश नहीं समझ पाते, उनके लिए हम हिंदी में बोलना चाहते हैं कि स्ट्रोक का मतलब है कि अचानक से कोई भी न्यूरोलॉजिकल सिम्टम हो जाए। मतलब अचानक से क्या हो सकता है कि एक साइड से कमज़ोर हो सकते हैं, एक से मतलब अपने विजन में थोड़ी कमज़ोरी आ सकती है अचानक से, या बात करने में अचानक से प्रॉब्लम हो जाएगी, ऐसी चीज़ें, या पेशेंट अचानक से बेहोश हो जाएगा। ऐसे इश्यू जब हो जाए या ऐसी चीज़ किसी की भी साथ हो जाए, तो इसका मतलब हो सकता है कि इस पेशेंट को स्ट्रोक हो गया हो। तो ऐसी सिचुएशन में क्या करना है कि ऐसी सिचुएशन में पेशेंट को आपने इमीडिएटली किसी भी हॉस्पिटल में ले आना है जहाँ पर स्ट्रोक का मैनेजमेंट किया जा रहा हो। तो स्ट्रोक में एक चीज़ जो सबसे इम्पॉर्टेंट है वो ये है कि पेशेंट को इमीडिएटली आपने हॉस्पिटल में लाना है, क्योंकि स्ट्रोक का ट्रीटमेंट टाइम पे डिपेंडेंट है। इसमें हम बोलते हैं कि जितना आप टाइम वेस्ट करते हो उतना आप ब्रेन के न्यूरॉन्स भी वेस्ट करते हो। तो उस लिहाज से क्योंकि ट्रीटमेंट टाइम डिपेंडेंट है, तो जितना इमीडिएटली आप टाइम में हॉस्पिटल में पहुंचाओगे उतना इमीडिएटली आपका ट्रीटमेंट स्टार्ट हो सकता है। दो काइंड के ट्रीटमेंट हैं, दो किस्म के ट्रीटमेंट है जो इमीडिएटली बेनिफिट कर सकते हैं पेशेंट को। एक हम बोलते हैं आए थ्रोम्बोलिसिस, जो 4.5 घंटे तक पेशेंट को दे सकते हैं। दूसरा है कि उसको मैकेनिकल थ्रोम्बोटोमी कर सकते हैं कि उसको अगर ब्लड वेसल में क्लॉट है या कुछ ऑब्स्ट्रक्शन है उसको निकाल सकते हैं। वो यूजुअली 6 से 8 घंटे तक की जा सकती है। तो जब भी पेशेंट को ऐसे सिम्टम हो जाए जो आपको लगे कि स्ट्रोक हो चुका है, तो उसको आपने टर्शियरी केयर हॉस्पिटल में जहाँ पर भी ये ट्रीटमेंट्स अवेलेबल हो लेना है, सो दैट उस पेशेंट को ये सुविधा मिल जाए। तो एक तो ये, दूसरा ये है कि ये बहुत सारे रिस्क फैक्टर्स है स्ट्रोक के लिए जो जिनकी वजूहत से ये स्ट्रोक हो सकता है। मतलब अगर ब्लड प्रेशर ज़्यादा है पेशेंट का, तो उस ऐसे पेशेंट को डॉक्टर के पास जाना है। डॉक्टर के जो सलाह देगा, जो दवाई देगा, वो दवाई उसको खानी है। बहुत दफ़ा ऐसा हो जाता है कि पेशेंट ब्लड प्रेशर, उसको पता है कि ब्लड प्रेशर है मेरा, मैं हाइपरटेंसिव हूँ, लेकिन तब भी वो दवाई नहीं लेता। वो तभी लेता है जब उसको कुछ सिम्टम हो जाएगा। बहुत सारे पेशेंट को हेडेक होता है, वो बोलते हैं कि हमें ब्लड प्रेशर चढ़ गया, तो उसी वक्त दवाई ले लेंगे। या पेशेंट उसको कुछ पाल्पिटेशन सी हो जाए, तो उसको लगता है कि मुझे ब्लड प्रेशर ज़्यादा हो रहा है, तो उस वक्त हो जाए। लेकिन ये बहुत ही मैं बोलूँगा बहुत ही ख़राब बात है, बहुत ही बहुत ही ख़राब बात है कि आप ब्लड प्रेशर का इलाज उसी वक्त करेंगे जब आपको लगे कि मुझे कोई सिम्टम है, क्योंकि ब्लड प्रेशर कंटिन्यूस ही रहता है, ये मतलब ओकेजनली नहीं होता। तो उन पेशेंट्स के लिए मेरी ये सलाह रहेगी कि वो अपने ब्लड प्रेशर को कम से कम 140 से नीचे लाने के लिए दवाइयाँ खाएं। तो बहुत सारे हमारे पेशेंट्स जो डायबिटिक है, उनको मैं सलाह देता हूँ कि वो अपने एंडोक्रिनोलॉजिस्ट के पास जाए, अपने ब्लड शुगर का चेक कराए। अगर हो सके तो घर में ही ग्लूकोमीटर रखे, खुद ही अपना ब्लड शुगर चेक करे, नोट करे, और हफ्ते 2 हफ्ते 3 हफ्ते के बाद वो नोट किया हुआ ब्लड शुगर अपने ट्रीटिंग फिजिशियन जो उसको इलाज कर रहा हो उस डॉक्टर के पास ले जाए, सो तो उस डॉक्टर को पता चले कि इसका ट्रेंड कैसा है ब्लड शुगर का, तो वो उसी हिसाब से उसका ट्रीटमेंट करे। चौथा है कि तीसरा है कि अगर पेशेंट बहुत ये ओबीज है, तो ओबेसिटी जो वो बहुत सारी डिजीज का रिस्क फैक्टर है। वो हाइपरटेंशन उससे हो जाता है, ब्लड शुगर ज़्यादा हो, डायबिटीज़ हो जाता है और स्ट्रोक हो जाता है ओबीज पेशेंट्स को। तो हमें अपने वज़न का ख्याल रखना चाहिए, हमें रेगुलर एक्सरसाइज करनी चाहिए, हेल्दी डाइट खाना चाहिए, और ज़रूरत पड़ने पे डॉक्टर के पास जाना चाहिए। स्पेशली ओबीज पेशेंट्स को एंडोक्रिनोलॉजिस्ट के पास जाना चाहिए कि अपने वो कैसे उनका वज़न कम कराए, उसके लिए वो क्या क्या ट्रीटमेंट्स अवेलेबल हैं, वो एंडोक्रिनोलॉजिस्ट के पास जाए, अपने ओबेसिटी का ट्रीटमेंट कराए, और उस ओबेसिटी के ट्रीट करने से उसके बहुत सारी डिजीज़ ट्रीट हो जाएगी। सबसे पहले उसका ब्लड प्रेशर ठीक हो जाएगा, शुगर ठीक हो जाएगा, और स्ट्रोक रिस्क भी कम हो जाएगी। तो मेरी यही रिक्वेस्ट रहेगी आप लोगों से, सुनने वालों से, जो भी यहाँ बर्दमन डिस्ट्रिक्ट में हैं, जिनको पता नहीं है कि यहाँ पर हॉस्पिटल एक है जिसका नाम है बंगाल फेथ हॉस्पिटल। वहाँ पर मैं डॉक्टर फेरोज एज ए न्यूरोलॉजिस्ट काम करता हूँ। तो मैं रिक्वेस्ट करूँगा अपने सुनने वालों से कि जब भी उनको लगे कि किसी पेशेंट का ऐसे सिम्टम हुए हैं जैसे मैंने बोला है, तो वो टाइम वेस्ट किए बिना यहाँ आ जाए या किसी भी हॉस्पिटल में जाए जहाँ पर न्यूरोलॉजिस्ट हो जो उनको ये ट्रीटमेंट दे सकता है। तो मैं ये रिक्वेस्ट आपसे, आप लोगों से मेरी यही रहेगी कि आप आइए हमारे इस हॉस्पिटल में, हम आपका अच्छे से ख्याल, अच्छे से ट्रीटमेंट करेंगे। थैंक यू।
बंद कर दीजिए।